First Edition begins this hour with a disturbing stat here in the Lone Star State. We are the lowest insured among any other state in the union.
Our Madeline Salinas joins us live in studios with what is behind the numbers and who is working to make sure that we are covered. Madeline?
That's right. The U.S. Department of Health and Human Services reports that the national medically uninsured rate in the U.S. is just 8.2%, while the Texas rate sits at nearly 3 times that at 21.7%. I spoke with a medical insurance expert about why the state is seeing that number and why he believes as time goes on that the number of medically uninsured people will actually continue to decrease. Sales manager of Insurance Solutions, Will Haven, says there are 2 reasons why Texas leads the country in uninsured rate. The first is that only about 49% of businesses offer health insurance to their employees.
Reason number 2 is a lot of people whose incomes are lower than what we call the federal poverty level, which, believe it or not, for an individual is $15,000 a year. They are not allowed to get Medicaid, because Texas did not expand Medicaid.
Haven says when it comes to looking at the Coastal Bend's uninsured rate as a whole, the region leads the state in medically uninsured individuals. In 2006, the uninsured rate in Texas was close to 28%, with that number dropping to 19% in 2022. Haven says the decrease has a lot to do with people utilizing the Affordable Care Act.
As long as we have the Affordable Care Act and it's not overturned by some politician, I believe that number will continue to grow of people having coverage.
Open enrollment for an Affordable Care Act plan starts on Friday, November 1st and ends on January 15th.
And every year we add about 10 to 20% as a nation to the health coverage through the Affordable Care Act. 4 out of 5 can enroll in a plan less than $10 a month. Probably about 90% of our clients pay zero. And that's because in South Texas, and this is a very well-known figure, people tend to get paid less.
Now, while the last day for open enrollment is January 15th, the last day to enroll or change plans for coverage to start on January the 1st is December 15th.